Hi, today we're going to be learning about independent bed mobility. We're going to be learning how to do slightly assisted and then independent mobility exercises while in bed, moving yourself upwards and downwards. One important thing to remember is that you don't want to have the patient using assistive devices or any other guardrails to support themselves, as we want them to practice this independent motion on their own. As is the PT, we're going to be assisting with a few of the motions just to get them in the right body mechanics so they're doing this safely for this independent exercise. For an upward bed transfer that's mostly independent, we want to have the patient start lying supine on their back. They're going to flex their knees and hips as close as they can and keep it close to the distal end of their buttocks. When they lift up their shoulders, they're going to press their shoulders into their side bodies into the bed and then push themselves back while lifting their pelvis. This will help them keep the trunk elevated and stay out from underneath themselves so they don't get their head or their back skin stuck. And it'll help them move easier in bed safely by themselves. For a PT, to assist them, we want to be able to lift their shoulders a little and slide them from underneath their scapula. We don't want to grab onto their shoulders and pull up their elbows, because this can be just a loose joint for them or just very uncomfortable, and we don't want to grab at their head or neck. Hi, I'm Katie. I'm a physical therapy student that's going to be assisting you with this transfer today. Can I get your name and date of birth?
Alexander Hamilton, July 4th, 1776.
Perfect. Thank you. All right. Would you mind bringing your hips into flexion? So bending your knees, bending your hips up as close as you can get them. I'm going to have you tuck your elbows into your side body. And then when we lift, I'm going to have you push into your heels, lift your hips off the table, and then press your elbows into the table, slide forward. Perfect. Thank you very much.
Thank you.
So the next bed movement we're going to be doing is a downward transfer. You're going to have the patient start in a supine position with their head on the pillow. Then you're going to ask them to flex their hips and flex their knees, positioning their ankles further away from their buttocks. And then as a PT, you're going to help them lift up their hips and you're going to help slide them down as they do the transfer, getting their buttocks closer to their heels. So, like this, further away, lift up, and PT is going to grab up by the iliac crest and pull them closer down. Oh, there. Knock, knock.
Who's there?
Hi, my name is Santi. I'm going to be your student physical therapist today. Can I get your name and date of birth?
Bill Nye, 0204 1942.
All right, just check your bracelet. Looks good. All right, so we're going to be doing a downward movement on the bed today. Can you start by flexing your hips and your knees? All right, keeping your heels away from your hips. All right, is it okay if I touch you?
Yeah.
All right, I'm going to put my hands right on your iliac crest. I'm going to help you lift up your hips. And on the count of 3, we're going to slide downwards, okay?
Okay.
Position your hips. All right, now lift up your hips. On the count of 3, 1, 2, 3. There you go.
Now, one last note, we want to make sure that when we can, if we position the bed flat, this makes transfers a little bit easier. We did demo 2 different types of transfers in this video, the upward and downward. Upward was completely independent. We just cued the patient and monitored them to see if they needed assistance. The downward transfer, we made sure that we used a little bit of assistance on their hips to help them get down, as that is a very difficult movement for our patients.